Health, Home, and Lifestyle. Presented by Paradise Fitness Center, changing lives since 1996.
Hafide, and welcome back to Health, Home, and Lifestyle. I'm here at the University of Guam with Corey Chin and Kathy Rivera Castro from the American Cancer Society Cancer Action Network. And there was a cancer policy forum that just wrapped up here at UOG. So, Kathy, can you tell us a little bit about your organization?
Thank you. ACS CAN is a nonprofit, nonpartisan advocacy affiliate of the American Cancer Society that supports evidence-based policies and legislative solutions designed to eliminate cancer as a major health problem. We are the advocacy group of the American Cancer Society. As you know, that most major decisions regarding health, cancer and cancer care do not only happen in the doctor's office, but also happen in legislative policies and reforms. So our job is to actually advocate with our policymakers in making sure that cancer is a priority.
All right, Corey, so that's where your presentation came in. I understand there are 5 different areas where you would like to see these changes focused in. Can you tell us a little bit about that?
Yes, so the American Cancer Society Cancer Action Network has 5 policy areas where we look on the federal and local level to make changes for cancer patients and their families. The first one is tobacco control, and you know the health effects from tobacco and its link to cancer is well known. So that's one of the areas where we focus on. The second one is cancer research funding. So this is primarily on the federal level because the federal government is the largest funder of cancer research. In order to get us to where we want with finding new treatments and eventually a cure, that research funding is vital to getting us to where we need to be at. The third one is cancer prevention, and that's kind of a really broad topic area because it covers cancer screenings for breast cancer, colon cancer. It also covers healthy eating and active living, which is dealing with the obesity issue, because there is a link between obesity and cancer, and so that's one of the issues that we want to explore more because a lot of places haven't tackled it to the point where they're addressing some of the larger issues around that. And then the other 2 are quality of life, which is specifically around palliative care, which is a medical specialty where it involves a treating physician as well as social workers and possibly chaplains and other things to take care of the entire patient, so not just the cancer that they have, but also any social or economic issues that they're facing. And also bringing together their caregiver and families to make sure they're involved in the decision making as well. And our final piece is access to healthcare. And so we primarily at the federal level, we're looking at making sure that there's healthcare coverage for everybody. There's challenges with the federal government, but on the local level, we're just making sure that there's policies in place where cancer patients do have access to treatments.
All right, so cancer is a huge issue in Guam, and of course we all know someone who's been affected by this disease. In fact, one person is diagnosed with the disease every day in Guam. And so from your perspective, how is Guam doing as far as tackling this issue from all those different areas?
Ever since we started doing advocacy here about 4 years ago, Guam has taken the lead in actually looking at a lot of these issues. Obviously, we have a lot of policy issues and not all of them might work here in Guam. And that's part of the challenge we have, is to make sure that when we're looking at a new policy, whether it actually will get the intended results that we want it to see, and also to make sure it's culturally sensitive and to make sure it can work here. Because in every place things are different. Insurance markets are different, healthcare systems are different, so just making sure that the policies we pass are good policies and that it can actually help the people they're intended to help.
Well, I actually saw some senators here in the room, so they did attend the forum today. Hopefully they'll be taking some lessons learned and putting that into practice at the Guam legislature. But when it comes to your advice as experts part of this organization, what advice do you have for senators or even people in the community on what they can do to help prevent cancer death rates in Guam or improve this issue in Guam? Any advice?
I mean, the most important thing is just for the awareness. So early detection and prevention, until there's a cure, early detection and prevention is the most important thing you can do. So make sure you get your regular screenings. You know, if you feel there's something wrong with you, go in and get it checked out. Don't wait till it's too late. You know, even if you might think it's minor, because a lot of times that's how these things happen. Maybe it's a cough or a soreness in your stomach. Get those checked out, because you'd better to be safe than sorry.
And one of the things we try to do is to talk to our policymakers, our legislatures, to ensure that our people have access to early screening, because early detection does save lives, and there are those in our community that don't have access to health care. But we try to address the fact that we can enact some legislation to help them get those basic screening tests, diagnostic tests, that would be able to detect these cancers and save their lives.
All right, well, thanks so much for joining us. Stay tuned. Coming up next, we'll have information on a farmers seminar that could help local farmers receive more benefits from the government. We're back after this.
Health, home, and lifestyle. Presented by Paradise Fitness Center, changing lives since 1996.